Hi, I'm Larry Mandel,
And I'm Rob Mandel.
and we're personal injury attorneys at Mandel Trial Lawyers. Today, we're going to answer some of the most commonly Googled questions about personal injury, catastrophic injury, and brain injury cases.
What is a traumatic brain injury? TBI is when some outside force is applied to the brain, causing damage to brain cells or altering the chemistry of the brain. And this is different than some internal event like a stroke or a disease like brain cancer or Alzheimer's. However, a TBI can also result from an external event that deprives the brain of oxygen, like choking or drowning.
What are the most common causes of a traumatic brain injury? By far, the most common cause of TBI is a sudden movement of your brain inside your head, what we commonly call a concussion. This usually results from a blow to the head, but can also happen from any sudden, rapid movement of your head.
What are the symptoms of a traumatic brain injury? Loss of or altered state of consciousness, disorientation, amnesia of some time period before or after the event, headaches, nausea or vomiting, forgetfulness, irritability, inability to think as clearly or as efficiently as you're used to. This may be accompanied by a general feeling of malaise, lack of motivation, anxiety, and even depression.
Can a brain injury cause problems years later? Yes, the effects of a TBI can last for months or even years. This is often referred to as post-concussion syndrome. Even though some people may recover without significant deficits, others do not. A TBI affects your higher executive functions, so some people may have lingering cognitive issues for years, even for life.
Can you fully recover from a TBI? The good news is that most people do basically recover from a mild TBI, also known as concussion. But you'll always be susceptible to greater harm should you sustain another concussion or blow to the head. Even for people with lingering issues, however, there are various treatments and therapies that can help a lot. And there are wonderful clinicians out there who specialize in treating TBI. It's best to follow up with these kinds of specialists to make sure you have the best chance for a full recovery. We work with dedicated TBI specialists on a regular basis, and we welcome your calls to find out more.
How do doctors diagnose traumatic brain injuries? Because most of the time, a TBI will not show up on a scan. A diagnosis of TBI is mostly a clinical one, based on medical history and exam, and the signs and symptoms. On occasion, someone with a more serious head injury may have bleeding inside the skull.
Does an MRI show traumatic brain injury? By definition, mild TBIs do not show up on a typical CT or MRI scan. If, however, there's bleeding inside the skull, such as a subdural hematoma, this will show up on those kinds of scans. More advanced MRIs, such as the functional MRI, many times can reveal white matter changes or brain function abnormalities associated with a mild TBI.
Can a traumatic brain injury go undiagnosed? Sadly, a large number of TBIs go undiagnosed because the victim or his or her parents don't take the injury seriously and decline medical care for it. For decades, a concussion was treated as a minor injury. We now know that it is quite serious and should always be medically monitored. If you suspect you or a loved one has had a TBI, see a doctor and then contact a firm like ours.
How important is family support in TBI recovery? The effects of TBI can be devastating to the victim and everyone around. It's crucial that friends and family members be understanding and patient with them during the healing process. Loving support can make a world of difference.
What effect can a traumatic brain injury have on your marriage or other relationships? A TBI can radically change someone's demeanor, personality, and behaviors in the blink of an eye. And the longer it takes to recover or to adapt to permanent situations, the more stress on close relationships. A TBI with lingering effects can tear those relationships apart. So it's essential that friends and family be patient with the victim and the healing process. Counselors and therapists may have to be brought in not just for the person with the TBI, but also to help guide and counsel those who love him or her.
So again, I'm Rob Mandel.
And I'm Larry Mandel.
We thank you for watching. If you have any other questions about traumatic brain injuries or any other catastrophic harm that you or a loved one has suffered, please don't hesitate to give us a call. We don't rest until we get you justice.